my name is Caitlin Labar. This is for Micro 206, Module 4, COVID, PCR, and RT-PCR. Make a video on the use of RT-PCR in diagnosis of COVID. In this assignment, you will prepare a video presentation to educate the public on the use of RT-PCR in the diagnosis of current COVID infections. Your video must explain the following. 1. Introduction to COVID-19. 2. The principle behind RT-PCR. 3. Viral targets used in the detection of active infection. 4. Interpretation of a positive and a negative test result. 5. Significance of the test in detecting active infections over past infections. All of the following information that I found comes from the Center of Disease Control and Prevention, or the CDC website. What is COVID-19? COVID-19 is a virus that is part of the coronavirus family, which is a variety of common viruses from head and or chest colds to more severe, less common diseases like severe acute respiratory syndrome, or SAR or SARS. COVID-19 is called SARS-CoV or CoV-2. There are multiple variants of this disease. COVID-19 is spread quickly from person to person with droplets that project out of the infected person's mouth or nose. When they breathe, cough, sneeze, or speak, some symptoms of COVID-19 include possible fever or chills, cough, shortness of breath, fatigue, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. There are a few ways to test for COVID-19. One of the best way, though, is a polymerase chain reaction, or PCR testing, which is only performed in laboratories. First, the PCR is converted from a single-stranded RNA to double-stranded DNA in a process called reverse transcription. The two DNA template strands are then separated. Primers attach to the end of these strands. Primers are small pieces of DNA designed to only connect to a genetic sequence that is specific to the viral DNA, ensuring only viral DNA can duplicate. After the primers attach, new complementary strands of DNA extend along the template strand. This occurs fluorescent dyes attach to the DNA, providing a marker of successful duplication. At the end of the process, two identical copies of the viral DNA are created. The cycle is then repeated 20 to 30 times to create hundreds of DNA copies corresponding to the SARS-CoV-2 viral RNA. What do the results for a COVID-19 PCR test mean? A positive result happens when the SARS-CoV-2 primers attach to the DNA in the sample and the sequence is amplified, creating millions of copies. This means the sample is from an infected individual. The primers only amplify genetic material from the virus, so it is unlikely a sample will be positive if a viral RNA is not present. If it does, it's called a false positive. A negative result happens when the SARS-CoV-2 primers do not attach to the genetic material in the sample and there is no amplification. This means the sample did not contain any virus. A false negative result happens when a person is infected but there's not enough viral genetic material in the sample for the PCR test to detect it. This can happen early after a person is exposed. Overall, false negative results are much more likely than false positive results. The main significance of the test detecting an active infection over past infection is to know if you are infecting other people.